Welcome to Dental AI Technologies. I'm Julia Michelin, and today I'm really happy to share my super guests, Dr. Bhumika and Dr. Amit. So they are dentists, researchers, and the founder of Dental Friend. We focus on dental and public health. Well, thank you so much for being here. Thank you so much for this conversation today about artificial intelligence in dentistry. So let's talk about a little bit of your background.
Yeah, so thanks, Julia, for the invitation. And it's our honor to be your guest in your podcast. And basically, we both are public health dentists, and we have done our masters in public health dentistry in India. And we have around 15 years of experience in dentistry. We have our clinical practice in Mumbai, and we have this startup called Dental Friend. So, how it started back in 2018 is we have seen a gap between the dentist and the patient. Like the patient comes to the dentist whenever the problem is severe. So whenever the problem becomes severe, or it goes for the extraction, or the pain is there, then only patient approaches the dentist. So it increases the cost also to the patient, and it gives the problem to the patient as well. So we thought, why not bring AI to this problem and bridge the gap? And that's why we have created this Dental Friend. I'll give one brief about this, how it works. Like you have to click the picture of your teeth and inner surrounding soft tissue through your smartphone, and upload in the software, and in within seconds it gives the idea what problem you are facing, and what probable treatment plans it must be having, and it connects to the nearby dentist as well. So this is the flow, and this is the background what we have.
Thank you. Thank you so much. And Dr. Bunika, from your perspective, coming from like India and working in India, what makes AI in dentistry a really interesting field right now?
India is has like a very large population, and it has like a mix of like urban and rural population. And what we feel is like now India is developing very quickly, and most of the people are now having smartphones, and they are getting used to technology. They want to learn more about the technology. So we feel that to its advantage, that people are now using technology at much faster pace than earlier. We can give them these applications or softwares wherein they can use and be more aware of their health.
Interesting, really interesting. We know that in India as well, we have like a lot of really good people in technology, and using this in dentistry. I think it's such a good match, right? For
Yes.
dentistry, this technology to dentistry. So I think basically what you're doing it's amazing, right?
Thank
Especially with your application and with the usage of it. And what are the most promising applications of AI, artificial intelligence, that you are seeing in India, but inside dental practice? Like in terms of diagnostics, of treatment plan, as you said, education, what else? Like what else
So,
you have been there?
yeah, so what, according to our suggestion, like basically the diagnostics and the awareness purpose, these two things it is helping. Like the diagnostic, our application is diagnosing or giving the idea about the gum issues, dental cavity or caries, or any precancerous lesions also. Like it gives the indication whether you are progressing towards the oral cancer. So it is very much impactful. And talking about awareness, it is giving awareness to the people, like they are getting the information at the comfort of their home, and at any time, like at night or day, anytime they are getting the information, and they are reaching or approaching to the dentist at the initial stage only, so that it should not become severe stage.
We are seeing that along with the diagnosis, now AI is also helping in like in the forms of like radiology. It is like, many people are using it in form of like radiology, and not only for like patients, but it is also used for dental students. So in many dental universities are inculcating AI in their syllabus, and in terms of like diagnosis, then radiology, educating the dental students. Also, we are like coming up with like a two-way, like you know, like a person to like AI person to interact with. So these are the new things what we think where AI is going in terms of dentistry.
That's really interesting. And you have like a really long background in public health and in search as well, right? In like publish. And so are you seeing a lot like AI into the field?
Yes.
Yeah.
So nowadays we are seeing that many research students, like who are doing their post graduation or maybe their PhD, they are including a lot of studies in their post graduation programs, wherein they can put in AI and see what is the result of AI and compare and contrast for the results which they are getting via AI and via the dentist himself. So we are seeing a lot of progress in that field in terms of research and publications also.
Yeah, that's really nice. We see that it's something that it's getting more common because technology is evolving really fast, right?
Yeah.
So in that way it won't be different. So that's why we should and we need to talk more about it. Even like this podcast, the goal is talk about it and bring like big names to talk about it, so people had more awareness of what is already there and what is happening. And how do you see like the future of dentistry of like in 10 years? How do you see like a dental practice perspective with AI?
Yeah. So what we see is it will become a supporting tool to a dental practice. It will not replace a dentist, but it will be a supporting tool so that the dentist uh, will save the time and give the accurate results through AI. And even the dental student, as Dr. Bhumika has mentioned, dental students will learn fast, and they can compare like how the manual diagnosis and how AI is diagnosis. They can compare that and they can get the education faster and accurate in their dental studies also. So it will be very much it is going to be very much clubbed with the dental practice in all over the world, and it will be very much beneficial also.
Really nice. And coming from working and doing like university and working and have experience in India, how do you see that AI could help? Like thinking about the oral healthcare or the public health right now in India, how do you see AI helping and having like doing a big difference into the field?
Right. So, being in the public health dentistry department, we conduct a lot of like community camps, and when we are conducting community camps, what happens is like one difficulty what we encounter is that we have to keep a large bunch of like sterilized instruments, and sometimes if we have like a bigger population, then sterilization and disinfection at the campsite becomes an issue. So we carry everything, but still. So what happens is that then there is a limitation that we are able to check only certain amount of people. But if we have AI, what happens is like this part of like sterilization and disinfection is taken care of. Like we just have to click the picture and then we get the diagnosis. So with the AI, we are able to cover like a larger mass, a larger population, and at the same time, when we have all that data in the back end, it is easier for us to tell that this population is like suffering from what kind of disease, like maybe like probably more of gingivitis or more of dental caries, and then we can take that data in the back end and then we are able to publish it effectively. So the process becomes quicker.
Yeah, really well said. Being saying like India is one of the biggest population of the world. That's definitely a lot of usefuls from AI. But how is oral healthcare in India right now? Like, is it a public service or there is no public?
No, there is no public service. So basically, India primarily people get themselves checked only at the dentist, or if they are like going to a dental institute, like a dental college or a dental university. So we don't have like proper dental insurance, wherein the patient is like a central dental insurance, which is like given by the government or something. And also there is not any provision of like whether the dental treatments are free via the government. So that is why dentist is like the main focus point of where the patient comes and gets himself treated. So the patients,
Oh,
there
okay.
is there is an improvement in oral health, but yes, we have like a very long way to go. So
And very few treatment options are included in dental insurance. Now the dental insurance companies are coming up with new ideas, new proposals, but very basic treatment options are covered by the insurance, and the costly one, like the patient has to pay by their pocket only.
Oh, okay. So basically, there's no free oral
Yeah.
healthcare or
Yeah.
free like universal healthcare, but that's kind of like the insurance that or the patient pay for it, or the government for some of them, for some of
Yeah.
patients.
Few of the treatments.
Few of the treatments, yes. If they are working with a certain like company or a certain certain treatments, like maybe like oral prophylaxis, or maybe like filling, or maybe a part of like, or root canal. But the root canal, if we are talking about like dental crowns, so that part is not covered. Implants are not covered. Anything which is related to cosmetic dentistry is not covered. Only the basic procedures are covered in the insurance.
Okay, got it. And thinking about the way that we could use AI, even into the cost of the treatment, what do you feel? What's your vision about it to make your dentistry more accessible?
Yeah, so basically, the AI looks premium initially, like it looks like very costly, but the basic idea behind this is to reduce the global burden of dental or oral health. How it is, because at the initial stage, if AI is helping to get the awareness about the dental problem which is happening inside the patient mouth, so patient will reach or approach the dentist at the initial stage, and it will reduce the burden of the cost to the patient. So AI is very much helpful regarding to that, what we feel.
Very nice. I agree 100%. And now let's talk about Dental Friend. So tell me everything of like how it started, when it started, and like what was the problem that you were trying to solve.
Yeah.
So basically, we have done our masters in public health dentistry, and over a long period of time, our focus is like as we discussed, is like we have a primary prevention, a secondary prevention, and a tertiary prevention. So we try to the patient comes to us usually when he has tooth pain or something which is like related to tertiary prevention, and then we have to either like do a root canal or an extraction. So we try to educate people at the time of primary prevention, and we tell them, okay, like these are the procedures, or this is how you take care of your health, and this is how you can avoid costly treatments or avoid dental problems. So that was like the whole purpose, wherein we wanted to like make people aware, and because we are focusing on a large population, so we wanted to see how they are able to get how so many people will be able to get access to their oral health. So that is why we took help of the smartphones and the AI, wherein each and every person is able to see the smartphone as able to take who's like in charge of their oral health. So that was the main purpose. Then the next part was like we created two types of checkups. One was the instant checkup where the patient was just supposed to focus on the concerned area, concerned tooth problem, and then we had the complete checkup where we take 5 pictures and the patient is able to see like everything what is going on in his oral cavity, and eventually go to the dentist and get himself treated. So that was the goal.
Pretty interesting. And when did you start? Which year?
2018. It was started
2018.
in 2018.
2018.
18,
Yeah.
So we got the idea back in 2017 and we launched the idea in 2018. That's
So it was even before pandemics, right?
Yeah.
yeah.
Even before. Well, that's
Yeah.
amazing. You're definitely even like pioneer for sure.
Yeah.
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 That's really cool. Okay, so you have this integration, and how many users you have it for the
Yeah.
right?
So in the total downloads till now, it is more than 50,000 downloads we have, and it is available both in the Play Store and iOS. And one unique feature what we have included is you can check the toothbrush status also. Like generally, what we suggest is you have to change your toothbrush after every 2 to 3 months, or the bristles are frayed and you have to change that. But the people are not changing it at the right time. So you can check through AI also. You have to click the picture of the toothbrush and upload it. Shows whether you have to replace it or you can continue using it. So that one feature also it is having.
Oh, it's really interesting.
Yeah.
Really interesting. You can add Luma brush into that. I can talk about this after, but it's really interesting. So you have a lot of users right now, and what's the usage that you see from the users? Well, like what's the feedback from there? Are they going more to the dentist? Are they being more aware of their own oral health?
Yeah. So very one case I'll mention, like in one of the user, they have used our application, and it flagged like the suspicious lesion inside his mouth. So he went to the dentist, and it came up like it was a precancerous lesion, and he was saved with the oral cancer problem. So that case was very much effective and impactful, what we remember. And similar to that, so many cases in the back end we see, like the patients are going to dentist regularly, and they are getting the treatment done to the nearby dentist, because that option also we have. So they are going to the dentist, and it increases the awareness also.
Oh, that's really interesting, because the AI detected the photo that he uploaded, and then he went to, and it was a cruise. So it really was the cancer. So we know how important it is to looking for a dentist and a professional as soon as possible, right when you have the detection. So that's amazing. That's really important.
Yeah.
Thank you.
Very much important.
Yeah, so that's why it's really like the uses of AI, it's there, your patients, your users are seeing this, are getting used to the technology. So that's why it's really important to have tools like Dental Friend available, and how like the user can subscribe or download, how they can find.
So they have to log in with their phone number and or their email address, and that is how they are able to then log in and then fill in their details, and then they are able to take the pictures and upload and get the results. So that is
and it is a freemium model. The basic test, it is free, and the comprehensive test, they have to pay for that particular test.
Okay, so that's the free available, and the premium is also. The premium is gonna be with the AI detection.
Yeah.
The freemium, the basic one will be the instant checkup, where he can take a single picture and he'll get the results. So that will come under the free category. And for the premium category, we have put all 5 pictures, and he'll get the entire result. of what is the oral health condition. Like that.
Okay, really nice, really interesting. And like my last question, it will be a little bit again focused on the future of dentistry. We know that the future of dentistry, we use technology, right? That's no future of dentistry without technology and AI, artificial intelligence, and all the fields of AI. It's something that it's here. You know, you are having contact with this since 2017, so you are much more familiar. So for that ones that think AI is a new thing or it's being more popular now, what advice you will do for the students, that ones who are inside the dental school? What you would say to them?
Right. So technology is like a friend and a foe. So how it is being used, that is how we can get it into like a positive direction. So we feel that a dental student should not get scared of dental of new technology, and that they should inculcate the new technology in whatever they are learning. So they should have definitely like strong basic skill set what they have been taught in the dental schools, and along with that, like they should adapt themselves to the latest technology, and this is how they will be able to progress in much better way.
Amazing. Well, thank you so much, Dr. Bhumika and Dr. Amit. It was a pleasure talking with you. Thank you so much for everything that you have been doing to the field, for being like pioneers and for creating Dental Friend and helping so many people, so many users. So thank you so much for our talk today. It was a really pleasure to talk with you.
Same,
Thank
same
you so
here,
much,
Julia.
Julia. We
Thank you,
are so
thank you so much
happy.
for the invitation.
Yes, we are so happy to be on your podcast,
Yeah,
and it is
it was great experience
yes, it's a
actually.
great experience, and always so
My
good
pleasure.
to exchange knowledge globally. Yeah.
It's my pleasure. I'm just